Good morning, everybody, or good afternoon, whichever the case may be. We are going to have just a really short session today on epidemiology. When we're looking at global health and all the issues therein, we really can't talk about it without talking a little bit about epidemiology. It sounds kind of like a boring subject, but actually, it's really very interesting. So, when we're looking at this, we're really going to look at it from a public health approach. That is how it is most useful in terms of global health. These are an outline of the topics we're going to be covering, and I will definitely put a copy of this slide deck in your module. This slide deck, by the way, is provided by the Centers for Disease Control and Prevention, available for public use. These are our learning objectives. So why do we talk about epidemiology as far as public health? Really, we're going to learn how epidemiologists look at public health problems and the steps that somebody in epidemiology will undertake when they're investigating a disease outbreak. We want to look at it from that public health approach because that's really more relevant to global health, and that's really how so many decisions are made as far as policy and as public policy and where we put our dollars comes from these epidemiological studies. So let's talk about public health in a much broader context. Public health, of course, these public health problems are very diverse, and we often think of them in terms of like infectious disease, which of course is definitely a public health problem. But they include much more than that. We're also looking at chronic disease. Public health has really been very interested in things such as obesity, diabetes, cardiovascular disease in the United States. So we have to look at the chronic disease aspect and how that affects public health as a whole. We also look at emergencies and injuries. For instance, how many motor vehicular accidents are attributed to texting? And that in turn, again, affects public policy. Another thing I look at is environmental health factors and other health threats. Is in a developing country, you may take a hard look at the water supply, the lack of sanitation, the lack of an infrastructure. If you're in an area that's just been hit, for instance, when Katrina hit, you're going to be looking very carefully at the factors affecting people's health that are related to that change in that environment. The lack of services they suddenly have. Regardless of the topic that we're looking at, epidemiologists take the same approach to public health problems by following 4 general steps. First, they're going to look at surveillance. So what is the problem? Try to identify. In public health, problems are identified by using surveillance systems to really monitor health events and behaviors that are occurring among a population. Next, we're going to look at what's the cause. What risk factors can we identify by looking at this problem and looking at the population that may have been a risk factor or a cause of the problem? You'll see this used not only in chronic disease when we're looking at risk factors. And, whenever we're talking about chronic disease, we talk about risk factors. All of that data comes from epidemiology. But you also see this when we're trying to delve down and to figure out what was the root cause of this outbreak of food poisoning. So we'll start trying to identify the cause. And then we're going to look at an intervention. Like what's worked in the past? What can we do to improve this situation? And then, of course, how are we going to do this? What is our implementation going to be? How can we change this issue? How can we have a positive effect? To implement the public health approach, practitioners use and apply a lot of different scientific methods. And these methods come from a lot of different core sciences. They'll use sciences such as public health surveillance, which we use to monitor public health situations. Epidemiology enables us to determine where diseases originate, how and why they're moving through the population. We have a disease. Why is this disease moving through the population so quickly? How can we prevent the move of this? We also have public health laboratories which support public health by performing tests to confirm disease diagnosis when we're looking at Influenza, for instance, we have public health laboratories that help us to determine the type of influenza we're dealing with and how many cases we have. They also conduct a lot of training and research in addition to that. We also have informatics, which is widely used in public health, as you can only imagine the amount of data that's collected. So informatics, just as it's taken on a big, has a large role in our health system anyway, now it has also a large role in the public health system. And then we're looking at prevention and how effective are our preventative methods? How effective were these vaccines in preventing the flu? How effective was this public, all the commercials that were put out on eating better or being more active? How effective were that in changing the behavior of the population? So all of those things are part of what really makes up public health. So when we're looking at it, we're first going to look at our big topic here is epidemiology. So we're going to look at it, how it aligns with the scientific approach, and how it's used in the public health practice. This is a definition of epidemiology. It's really kind of wordy, but if you look at it and break it apart a little bit, it's the study of the distribution, so where is this problem, and the determinants. What are the risk factors, what caused it, of health-related states among specific populations, and how you take that information to control the health problem. So when we're looking at, you might be looking at a certain population. Maybe we're looking at infants born to young mothers. What are the determinants? What determines that infant will be born healthy and not low birth weight? So we might start looking at their nutrition. We might be looking at if they smoke or not. So those are the kind of things you're looking at in epidemiology. So the first thing you do when you're looking at public health is, first of all, you want to discover, the agent, the host, and the environmental factors that affect the health of that population. So, what are the characteristics of this agent, of this certain disease? And what are the characteristics of the host that gets that disease? Are there any environmental factors that play a role? Next, you want to look at the relative importance of causes of illness, disability, and death. Is there a strong correlation? Is this something that is affecting our population to a significant manner? Because when they make decisions regarding policy and regarding spending of healthcare dollars, they want to see, hey, how does this fall on the priority list? This specific topic. They're going to spend more money and be more proactive about changing policies and something that is widely affecting the population versus something that's only affecting a small portion of the population. Then they want to look at the segments of the population that really have the greatest risk of this particular problem. Who's most at risk for this problem? Who's most at risk for suicide? Who's most at risk for diabetes mellitus? Then we want to evaluate the effectiveness of the healthcare programs and services that have been implemented in improving this particular thing. In a developing country, we might be looking at malaria. How effective were these mosquito nets? So that's kind of the way the purpose of epidemiology and public health. So when we're looking at solving health problems, we want to let epidemiology practitioners use a 4-step scientific approach that includes the data collection, the assessment, the hypothesis testing, and the action. So when you're using the scientific approach, data is collected and an initial assessment or hypothesis is conducted. You then test the hypothesis just like you would do in any scientific method, and the resulting information is used to come up with a plan of action. An example might be you collect some data. Let's say, for instance, they collected data on lung cancer. And they found out that when they collected this data, they found out that there was a strong correlation between lung cancer and cigarette smoking. And then they kind of tested this. Were people who didn't smoke cigarettes, what was the prevalence of lung cancer in that population? And because of all this, and all the studies about cigarettes and their adverse health effects actually did come from epidemiology. So then that ends up affecting public policy. They've created non-smoking zones. There's big initiatives and media initiatives to uh, encourage people not to smoke. There's money put into it. There's taxes on cigarettes. It affects, it has a big downstream effect if it is something important that the powers that be deem important and deem that it needs to be dealt with. So before we go any farther, let's just look at a few key epidemiological terms, and then we'll just take a short break. These are some terms you probably know, but let's just go over them a little bit. An epidemic or an outbreak is when there is an unusually large occurrence of something in a population. It's more than you would expect. So we will hear this talked about from time to time with the flu. A cluster is when you have a group of cases of a particular thing in a particular region that's out more than expected, but it's not quite as wide as an epidemic. Endemic is a disease or condition that is present among the population at all times. We could almost say that obesity has become endemic in the United States. Pandemic, on the other hand, is a condition that spreads across regions or becomes global. The last thing we look at really closely is rate, and we'll talk about that a little bit more specifically, but we want to know how many cases occurred over what period of time, and what was the population you're looking at. If you have one case and you're only looking at 10 people, that's a tenth. But, if you're looking at a huge population, one case may not be very significant. So let's pause. There's a couple of questions for you guys to answer, and then we'll start back.